Hey, welcome to our show, and thanks for making us a part of your day here on Atlanta's CW Network. I'm attorney Gary Martin Hayes. In this segment, I'd like to give you some sobering stats from the Insurance Institute for Highway Safety regarding car wrecks. In the U.S., there are approximately 5.5 million motor vehicle collisions a year. What are the consequences of those wrecks? Well, these range from approximately 35,000 deaths from these collisions to around 50% of the people walking away from the wrecks with no problems whatsoever. But what happens to the other 50%, the 50% that must seek medical care for their injuries? To address this question, I'd like to introduce Dr. Connelly. He is a board-certified chiropractor who's been treating patients here in Georgia since 1998. And over that time period, he has treated over 5,000 trauma cases with over 80,000 patient visits. He's also been used as an expert for second opinions on more than 3,000 cases. And if that's not impressive enough, let me give you one more fact. He is one of approximately 20 doctors in the state of Georgia that is listed as a review agent. This means he provides professional opinions about whether or not the care of other chiropractors is reasonable and appropriate. And this expertise certainly garners him respect from other doctors as well as the insurance industry. Dr. Connelly, thanks for being with us here today.
Glad to be here. Thanks for having me.
What is the most common complaint, common symptom that your patients have after a car wreck?
Neck pain, without a doubt, neck pain. And it's not just with my patients, also the national statistics show that as well. In fact, neck pain attributes for about $8.8 billion a year in claims related to auto injuries.
Some people refer to these neck injuries as whiplash, but this is not really a diagnosis, is it?
You're right, Gary, it's not. Whiplash is actually more the mechanism of injury or how the injury occurred. The motion of the neck as it goes back and forward, and I'll show you on this diagram, as the neck goes back and forward, it actually tears the ligaments. It also could tear the muscles and sometimes could even affect the disc. This can result in muscle strain, neck tearing of soft tissue, and other damage like nerve root impingement, ruptures of ligaments, fractures, or even dislocations of the cervical spine.
Now, these minor neck injuries can become chronic problems over time if they're not treated correctly, can't they?
That is correct, Gary. In fact, about 10 to 30% of people do develop lasting symptoms after an auto collision.
What is the best way to make sure that patients don't develop chronic problems from a collision?
Well, let me give you two things that I focus on in my practice. Number one is to get an accurate diagnosis to find out the cause of the pain. And number two is to lay out a specific course of action or treatment plan to be able to get the patient better based on their diagnosis.
Well, how do you go about making sure you have an accurate diagnosis?
That's a great question, Gary. In fact, there are a few things that I follow that are typical guidelines to get patients better to develop a diagnosis. Number one is to take a good history from the patient. Have them tell where the pain is and what the mechanism of injury is. Number two is have them indicate, like on a pain drawing or on a problem list, to be able to determine the problems they're having. And I use the word problem because it's not only pain that a lot of these patients have, they could have numbness, tingling, burning sensation, weakness, or swelling. Number three is I'll do a consultation based on what they report their problems as. And number four is I'll go through and do a very focused examination based on the area of complaint and some of the things that I picked up from the consultation. Once we get these things together, then we may do additional testing like X-ray, MRI, CT scan, based on what the findings are from the examination with the patient's complaints.
So the combination of the history, your consultation, examination, and the diagnostic testing really helps formulate your diagnosis.
That's correct, Gary. In fact, each one has their own particular point that's very important. So they all come together. When they come together, that's called clinical correlation, where basically all the things add up to give us a good working diagnosis.
We talked about neck injuries being the most frequently reported injury after a car wreck. Tell us more about one of the most common injuries that you see involving the neck.
Sure. Let me give it to you in medical terms. So the term is cervical facet capsular ligament tear.
Help us understand the medical terminology, if you would, please.
Sure. Let's go over some things first. When we have the anatomy and physiology of the area, we have the disc, which is like the shock absorber. We have the bone, and then on the back we actually have two facet joints. With those facet joints we have an articular cartilage, we have a meniscus in between, and on top of it we have something called a capsular ligament that helps to keep the joint in place. So when a person gets into a rear end collision and their head develops a mechanism where it goes backwards and forwards, a lot of times that mechanism will tear those capsular ligaments.
What have you found is an effective test for diagnosing the injuries to these ligaments?
Well, motion x-ray is invaluable. So basically, another way to call it is functional radiography. So many times patients have a traditional x-ray that may show a patient in a static position, but when we see them in motion, we can actually see the stability of the facet ligaments and all the other ligaments a lot better.
Now, I love this technology, and the scans and the videos that you're able to record are invaluable, not only by it helping you diagnose an injury, but for us as attorneys, being able to show the insurance company or the jury the injury.
The technology is amazing, and in fact, my office is one of a few in the state that actually use this technology and this equipment to detect capsular ligament instability or just instability of the facet joints altogether. And also a great thing about it is that you can't fake it. It's something that when you do the test, you could actually see the stability of the ligaments, and it's reproducible over and over again. But dynamic motion x-ray is great for observing the stability of the ligaments and the motion, but also it's better than a static x-ray, which is typically better for arthritis, typically better for fractures or dislocation.
This is fascinating information. I know our viewers are going to be blown away with the technology. And as I mentioned in the beginning of our show, Dr. Connelly is one of approximately 20 chiropractors here in Georgia that is accepted by the Georgia Chiropractic Board as a review agent. This means he's often called upon to decide whether another chiropractor's treatment was reasonable and appropriate. Now, when we come back, you will see why he is held in such high regard by not only his patients, but also by the insurance industry. The motion x-ray machine we're about to show you is amazing. Now, if you or a family member have been injured either from a car wreck or an on-the-job accident, then please do not miss our continuing interview with Dr. Chris Connelly. And if you'd like to speak with me regarding your personal injury or workers' compensation claim, I make it easy for you. Just pick up the phone and call me right now. The number is 1-800-WIN-WIN-1. The consultation is free. It is completely confidential. There is no obligation.